I'm leaving these gloves on. Pretend they're not here for right this minute, but I'm going to leave my gloves on because I'm getting tired of putting gloves on already. So you're going to come in, introduce yourself, wash your hands, provide privacy, check the chart, explain the procedure, all that good stuff. Yes, ID your patient. And you ID your patient, how?
Ask them their name.
And their birth date. Because sometimes you have people that have the same first and last name. So birth dates are important to make sure, because if you have a Billy Jackson and a Billy Jackson, and you look at the wrong one, go to the wrong room, so you're determining that by the birth date to make sure you get the right patient. So I've identified my patient. I have all my stuff ready. You guys need to have a trash can right here because you're going to be putting stuff into the trash can. Okay, so you're going to want to have a trash can. I'm going to set all my sterile stuff up, and you don't have to have gloves. Like I said, pretend I don't have gloves on right now. I'm going to set my sterile stuff up, and I'm only going to use one of these for this guy, so he doesn't have a bad one. All right, so really quickly, the smaller size syringe you use has a higher caliber power of irrigation, right? So it's going to be like super power to moderate power, okay? So the bigger the syringe, the less the force, basically. I like to use these because if you blast them with this stuff, sometimes it blasts in your face and on you. If you think you're going to risk anything of getting in your eyes, you need to have the splash guards on as well, okay? So I have my thing, and this should actually be in a container. Do we have that? Does anybody have an irrigation container in your kit?
Yeah,
But one of you go get that, because I can't demonstrate this. Like I have to have the container because this is not going to be sterile. This has to stay sterile. That way I can show you. So I'm going to prep all my gauze and stuff. So your order, when you looked at that, is going to tell you what type of dressing you're going to do. In most facilities, you need to know your facility policy. Most facilities have wound care nurses. They may come by and do it, or they may write for you to do it, or might be PRN dressing changes, or whatever. So make sure you look at your policy and you look at your orders. So I'm going to open this, and I open it out, away, and I'm going to open it away, and then, okay, thank you. All right, so my saline is, well, I'll do the saline in a minute, but, okay, so I've got those set up. This is an ABD pad. You'll need that. It's the tampon abdominal. Okay, so I'm going to open it, and you open it the same way you open the lips here. And what I do is just open it out this way, like so. So it's opening out, and then I just set it over wherever I need it. Okay, so it's still, you need to keep it on your sterile setting there, and that's dry. I just kind of move this over out of the way, and then move that over. And if you want, because I'm a ripper, I don't like to leave everything, I push that back or however I'm going to do that, but I'm going to leave that on there, okay? So that's really all I'm going to use for my dressing change. Depending on what kind will depend on how much of this stuff you need. So I'll open one of these also. So probably want this too. Okay, open this up. The biggest thing is making sure it stays on the sterile portion of that. Okay, and I can walk over here.
I'm sorry.
I don't have gloves on right now. I'm just going to put
I'm
this.
sorry.
I'm just going to put this here. You guys see? So I have all my stuff readily available right here. Yes?
Yes.
And I don't have gloves on. I'm not sterile or anything. I want to walk around like this all the time too. So next I'm going to go ahead and I'm going to lip this. I think if you're going to use this, you have to lip it if we're going to do irrigation. So you're going to lip it. Make sure you have the prescribed solution. Sometimes you'll see Dakin's ordered, which is a dry, it's kind of like bleach. Sometimes saline, sometimes bicarbonate, just whatever they want to do. So this is going to be saline, so I'm going to take this. Do I have to have gloves on to do this?
No.
I'm going to check the expiration date, I'm going to lip it, and I'm going to put saline in here. And so I'm going to lift this straight out, and I'm going to put this in like this, and I'm going to put this straight back in. Why do I do it like that?
So it stays sterile.
Because this is not sterile, and this is not sterile, but everything inside that container is sterile. Okay? So it goes straight in there. Right? So I've got my saline in there. Now I would put on clean gloves. So I'm putting on clean gloves. I have clean gloves on now.
You're good.
Okay? So I'm going to come over here and I'm going to take the dressing off. When you guys take the dressings off these, oh, you know what? You didn't give me tape.
Oh.
I got some right here.
I didn't prep my
Are
tape.
those sterile gloves or clean gloves? I heard
Clean.
you say
These are
They're
clean.
Clean
not
gloves.
sterile.
I just never took my gloves off. 'cause I
Right.
didn't wanna mess with them.
Okay, I just want to make sure we
So
didn't.
I would, the whole time I'm prepping this, I can prep it with my hands.
Okay.
So you can do it with your hands because it's sterile. You're opening and prepping all your sterile stuff. Or if you want to put gloves on, you can put gloves on. It's up to you.
And you understand why she does all of that first?
So I'm just looking at the dressing. I'm going to go ahead and you can always overdo it and then you can tear pieces off. So I'm just going to do that. I'm going to get my
Would you tear the tape before you put your clean gloves on, or no? Or does
You
it
can,
matter?
or you can do it after. I would. It doesn't matter really, because it's going to be on the outer portion of the dressing. So I've washed my hands, so my hands are clean, and then I'm going to put my tape on here. Make sure you clean your tables off, and you wouldn't want that hanging like that either. Let me redo that. Make sure you wipe your tables off with antimicrobials if you use them like this, because who knows what's on the tables. So I have 2 for my sides. I'm going to get 2 for my ends, correct? I'm also going to have a pen with me because I'm going to have to write on the dressing when I'm done. And in your skills kit, you should have the equipment to measure, and you should have sterile Q-tips. Were there any sterile Q-tips over there?
I know.
Okay, if you get sterile Q-tips, and we used to have them, or they used to come in your kits, if you look at the sterile Q-tips, it has on the side a measuring instrument, which is like a ruler on the paper, because when you're doing wound changing, you don't want to use stuff back and forth. Everything needs to be disposable per se. So the sterile Q-tips on the side have like a ruler on the paper, so when you open up the sterile Q-tips, take your Q-tip out, you can measure the depth of the wound, and then you'll see where it's on there, and then you can measure it. Okay, it's not always something you have to do. It's more like what the wound care nurses do, but it helps you to determine if it's healing better or whatever. So I've got my tape set up and everything. I've got my clean gloves on, and next I'm going to go ahead and take this dressing off. When you're taking this off, don't do like this and pull this off the patients like that, because that's going to hurt really bad. What you need to do is when you're actually taking the tape off is you need to hold the skin down and remove the tape slowly, like so. So you would actually hold the skin and pull the tape. Yes? So that, because if these people on steroids, they're going to have paper thin skin, or you're going to end up with skin tear, and then that's going to be big trouble. So I've got all the tape lifted. Next thing I'm going to do is, do I want to flip all this junk everywhere? No. So I'm going to grab everything in here and kind of do like this. And I have everything all in a ball right here. And then I'm going to grab right here, not underneath. I'm going to grab right, my hands are sweaty now. I'm going to grab right here. I was going to grab right here. And I'm going to pull like this and take it off. And then I'm going to dispose of that. Any questions so far? No? So I took off his dressing. Now I can actually assess the wound, yes?
Yes.
So what do you want to note about this wound when we're looking at it? The size, so we're going to look at the size. Color. If there's a smell to it, if there's drainage in it. And when you document, you'll document the sizes, but we don't always get to measure if you don't have the equipment, so it would be approximate. So if I was to look at this, I would say it was a wound approximately 4 inches in length and approximately 1 inch in width. And make sure you document approximate, because these are approximations, they're not exact measurements, so you want to put approximately. That covers you, because it's an approximate thing. So we've done all that. Next thing we're going to do is cleanse the wound. So when we're cleansing, we put on sterile gloves, yes, no? Okay, so I'm going to put on my sterile gloves.
I don't see any sterile. Do you know
There's
where they might be?
The Q-tips?
Yeah.
I don't know, after the lab got rearranged.
Yeah.
Do you guys have sterile Q-tips in your kits?
I think so. I believe so.
Okay, well you guys can bring them with you if you want, so you can do it. Okay, so I don't want to touch the wound with my gloves or anything like that. I can put my gloves here as long as it's not over there. Yes?
Mhm.
Okay. Now, if we're going to irrigate, you have to have an order to irrigate, so you can't just do that on your own. We can't put fluid onto the wound without an order saying irrigate with 0.9 normal saline or whatever. You can't just come in and irrigate it. So if I'm going to irrigate this, are these hands going to stay sterile?
No. I don't know. No.
Is this sterile?
No.
No?
No.
Just yes. The top's not sterile.
The top's not sterile, the inside is sterile, yes?
Mhm.
Okay, so this is going to be my non-dominant hand, or my dominant, however you want to do it. So this hand, I'm going to reach here and I'm going to go ahead and draw up whatever I want. So I'm going to draw up probably a full syringe full so I have enough. Yes? And it's okay for me to touch this as long as we're not sticking our fingers in here. And right now my hand's sterile, but you just don't want to go in there. That's all sterile. So I'm going to come straight out here. Yes? If I touch right here, is this sterile to sterile?
Yes.
Yes, because it was in there. So I can keep this hand sterile by touching here, and this hand here is not sterile anymore. So I'm going to go from center out and center out. And this is on the lateral part of the leg. Whenever you're irrigating, you need to position them to facilitate drainage. So if it was on his bottom, I would have him on his side. If it was on his abdomen, I would probably put him on his side again because you want to facilitate that drainage to go downward, not to sit in the wound. You guys see what I'm saying? So this is on the lateral aspect of his leg, so it's going to facilitate downwards. And there's a chucks underneath him because you would want to put a chucks under there because all this stuff has to go somewhere. Your checkoff sheet says you can use the basin to do that, but there's no way you're going to hold a basin and irrigate that unless you have eight arms. So this hand's still sterile. I'm going to do from the center out and the center out. And you don't, I will tell you guys, don't do that because it's going to end up on you. It's just a slow to remove that extra stuff, okay? So center out and center out, okay? If you need to go back over a couple times, go back over it a couple times. But you don't want to blast them. So is this hand still sterile?
Yes.
Yes.
Okay? So I'm going to take my unsterile hand here. I'm going to put this, and don't hit the outside. That breaks sterile. So when you're putting this in, make sure it goes straight in and straight down. Because you might have to pull it back out. You might need it again. So sterile. Okay? This hand's not sterile, is it? No. Okay. So I have to repack my wound. So this is a wet to dry dressing change. Or, well, nah, I'll just do a regular. Well, he probably should have a wet to dry, but I'll do a regular dressing change. So make sure your instructor tells you in the beginning what type of dressing change you're going to do. Because right now, if I had to do a wet to dry, I would have to re-lip my stuff and saturate these. Okay, which I could do because is this hand sterile? No, so I could actually come over here and I could actually come over and lip that, put it over here, or put some in here, and then put it over here because this is no longer sterile, right? So I'm going to go ahead and pack him. When you pack these and you take them out, you need to come straight up and you bunch them up like this. Please do not try and fold these to make them neat. If you're OCD people and you like to have this all neat like I do, get over that. Just bunch it up. And you're going to stick them in here, okay? However you want to put them on there. And they'll usually stick into the wound. If you're doing a wet to dry and you've had to do that, it's going to stick into the wound, okay? Don't touch in there. You're touching the gauze that's going onto the wound, correct? All right. So I'm going to put one more on here. Maybe one more. Stay right there, little gauze. Okay. Then if you would like to, okay, you can use the overdressing here. Is this hand still sterile? Okay. Can I reach here? Okay. I'm taking this out. I'm going to place this over. And it's just a matter of dressing it. There's really no method to madness. And then I want my ABD pad. This should be the final thing you put on there. Is the blue line up or the blue line down? Blue to the sky. Anytime you see blue usually in medical, it goes up. Okay, so blue line to the sky. I'm going to place this directly over the wound because this is what's going to absorb most of that. Put this in place. I still have a sterile hand. Do I need to be sterile anymore?
No.
Not really, because all I'm doing is placing tape on there.
If you touch his skin while you're putting that gauze in,
This?
does that break when you're putting the gauze in?
Back here,
Yeah. Does that break your film?
if you touch his skin, yes.
Okay.
So like I said, when you're putting these on and you're packing them in there, if you're really packing these and they're wet in the wound, they're going to
They're
stick.
gonna stick.
Yeah, they're not going to be like on him. So you see how I bunch it up like that and I just put it directly onto him like that? I'm not actually touching in there. I'm touching the gauze to him.
Mhm.
And then I'm going to put, like I picked this dry one up and put it over.
Right.
And then the ABD goes straight over. And that goes right on there. And now you don't have to be sterile because the wound's covered. Then I'm going to put my tape in place. And it should only be on the edges. You don't have to put 27 rolls of tape on your patients, guys. Just cover the edges up.
So would you do the same thing if it was dry, just not with
You would.
saline?
You
There's
would.
no saline.
Mhm.
Okay.
Except it's dry.
That's coming out the bottom. You don't want that coming out. Except it would be. It wouldn't have.
them up like she did though. Punchy.
Yeah. So you're just going to make sure all 4 edges are covered. That's the big thing on that.
There you go.
And then you can take your gloves off just like you would take your normal gloves off. These are really sticking today. So I'm going to take those off and get rid of those in the trash can. And then you would have a pin on you, like I do right here.
Okay.
And I'm going to go right here. And what's the date today?
27.
I'm going to put 2/27/16. I'm going to put the time. We'll say 1600.
45.
And then I'm going to put my initials on there.
Initial.
And that's it.
Date, time, initials.
And a Sharpie marker is the best thing to use on that, actually, if you have a Sharpie, because then you don't have to push very hard with the Sharpies and it leaves the mark on there. Make it legible, though. People need to be able to read the date and the time. Okay? Any other questions?
And you document.
You'll document. So you're going to document aseptic technique, because this is an aseptic procedure. You're going to document how the patient tolerated the procedure. You're going to document the type of irrigation that you used, if you use irrigation. So normal saline, sterile saline. You're going to document the description of the wound when you took it off, if it was approximately 4 by 1, if it looks like it's approximated, or if it's clean, or you see new cell growth, or if you see pus, you would document anything like that. If you have any odors, you would document that. If there's a bunch of drainage, you would document the drainage. So when I take that off and you actually pull it up and look at it, you're going to document what kind of drainage was that. Was it sanguineous? Was it serosanguineous? Was it serous drainage? What did the drainage look like? And you can document the amount. If it's really saturated, you can put a copious amount. Dressing had a copious amount of saturation, or if it's just a little scant amount of saturation, and you're going to describe that. Describe your irrigation as far as what solution you use, and then that you put a sterile dressing back in place the date and time. The patient tolerated well. What is one other thing that
Are
you?
you gonna have them check the depth? Is that what the cotton swabs?
That's what the cotton swabs are.
Is that on the sheet?
It's not on the sheet,
Okay.
but I just want them to be aware of it so that you'll know, because some facilities will want you to do that. Another thing, and it doesn't say this on your checkoff sheets, and this is something I've always said about it. When you're going in and you're explaining the procedure and you're talking to the patient, what is something you think you would need to do to this patient before you do a dressing change?
Pain medication.
Pain medication.
There you go.
So assess the pain, because it doesn't say it on your checkoff sheet, and I probably will add this on here when I update it, because you really need to ask the patient that, especially a wound like he has, that's not going to feel good. So I would do a pain assessment, and if the patient does need pain meds, they probably need some IV pain meds, so they'll kick in quick and you can go ahead and do it. If not, you can give them oral pain meds and wait 45 minutes to an hour and come back and do the dressing change so that the patient's not suffering. So I'm going to update this, but write it down in a mental Rolodex, and please put on your sheets, assess the pain before you do your dressing changes. Okay? Because if they're hurting really bad, it's going to be really hard for both of you. Okay? Any other questions? The biggest thing is just staying sterile.